Hello everyone, welcome back to my YouTube video channel. Today I'm gonna present to you the house Medit500 can help you to present the treatment plan for orthodontist patient. As you can see, here is the model I just bought. I'm not sorry, I just scanned it, and as you can see that here's the patient situation. Her main complaint is that she have anterior open bite, and also her number 8 and 9. You can see 8 and 9 right here. Let me zoom in a little bit. You can see that they are kind of wear and tear, and so that's her bite. You can easily can present the treatment plan for patient, how you can improve it. In this video, I will show you from the scan of the upper and the lower and how the occlusion come about. So take a look at the upper arch right now. I scanned the upper arch for the patient, came to my office several times for cleaning and sometimes like that. Now we have an opportunity to get to know patient more, and so we can talk to her about the option of correcting this front tooth right here, number 7, 8, 9, 10. As you can see that the evidence of teeth grinding on the upper teeth and down to the lower anterior teeth, very clear with the wear and tear of incisor edge area. And with the model like this, it's so nice to show the patient instead of the alternate impression traditional way. You cannot show the patient about the problem. Now, so as you can see that the evidence is so clear that wearing of the anterior 7, 8, 9, 10 all wear out, the incisor wear out. So that's why we need to figure out why. So one of the problems that you can see in this on this patient is that you can see there's a couple of premolar rotation. Patient have rotation right here on number 12, rotation distally on the buccal cusp and mesially on the lingual cusp, as you can see. So that what we can do when we move this over here, you can create some room and pull the teeth back and correct her bite problem that she have an overchet and overbite. Same thing right here. There's a gap right here on between number 6 and number 7, which can be easily corrected with orthodontist treatment. Same thing for the space between number 5 and number 6. There is more space there as well. And if you look carefully on this view here, I would say if we can move number the lingual cusp of number 5 back distally a little bit, we can create a small room to help create a better occlusion for the patient. That would be wonderful for her, and because you're gonna see how the occlusion when I put the teeth top and bottom together. Other thing that you can see also is that on the number 14 here, the contact between number 14 and 13 is not really broad, and that's because there might be a small rotation of the 14 toward the meso and small rotation of the number 13 toward the distal, so it create a very pointy contact. Orthodontically, we can correct and help to create a better arch, and smaller arch would help the connect with the bottom teeth, which is I'm going to show you right now, and you can see what's going on. And so you say, what's going on? Well, take a look. The patient have very nice arch, as you can see, really nice lower arch, really nice. However, what you see there is the problem is that the patient have the evidence of anterior, upper and lower anterior grinding. As you can see, all those incisor edge is really worn out. What's going on? Well, if you look at this view right here, you see, what do you see? The occlusal plane of the patient here is completely off. The anterior teeth are super erupted, and that's the reason why the patient end up having a space between the upper anterior and lower anterior, which call teeth grinding. So we'll take a look here together. So that you can see that when we put those upper and lower teeth together, there is the problem with the anterior teeth. The patient have a pattern of grinding on the incisor edge area of anterior upper and anterior lower teeth, and also there's an overbite. This kind of problem here that I mentioned to you before with the upper arch having some space issue, some point-in contact issue of the posterior teeth, we can create more room and close these gap together and extrude 8 and 9, 7, 8, 9, 10 down and backward a little bit. You're going to see a great turnout with the braces established and finished up for a patient. So I would highly recommend to you the 3D scanner. If you use it, you're able to present a treatment plan to the patient immediately on the same day, rather than having to rely on the alginate impression material or the Yellowstone. You pour the cast and you wait for a few hours. The staff had to trim the model. It takes so long, but I love how I can able to present the treatment for a patient on the same day. Technology, utilize technology, you enjoy it pretty much with anyway, I'm using the Medit500 and I love it. It's a great tool for case presentation, especially orthodontist treatment in this particular video. Study model, presentation right on the same day. Enjoy your day. Have a great day. Bye bye.